Hey there, parents and advocates. Today I want to talk about something that's often misunderstood in special education, how mental health plays into residential placements, especially after a recent BSEA decision. So here's the deal. If you're fighting for a residential placement for your child, it isn't just about their clinical or mental health needs. The law says the school district is only responsible if your child's educational needs require 24-hour care. If your child needs residential treatment mostly for safety or clinical reasons, like for therapy or mental health stabilization, the district probably isn't on the hook to pay. But here's where it gets strategic. Mental health issues can absolutely impact education. The trick is, you have to show that anxiety, depression, or other diagnoses are directly interfering with your child's ability to learn, access instruction, or make progress on their IEP goals. It's about drawing a line from clinical challenges to educational impact. Let's talk about language, because this is huge. Neuropsych reports, IEPs, clinical letters, they can't just say your child is anxious or depressed. They have to spell out how those issues get in the way at school. Like, my child can't attend school due to severe anxiety, which means they're missing instruction, losing skills, and regressing academically. That's the kind of detail that matters. Another big piece, documentation. You have to show the district that you've tried everything less restrictive. Day school, outpatient therapy, in-home supports, and none of it worked. If your child can't make meaningful progress with those supports, you're building a stronger case for residential. And don't go it alone. If you're working with outside therapists, evaluators, or wraparound providers, everyone needs to be on the same page. Every report, every recommendation should tie your child's mental health needs to their educational needs. Here's an important lesson from the BSEA's recent case. The hearing officer found in favor to the parents, and that the district was ordered to provide student with a placement in a residential special education school for a period of 17 months, and that the district shall hire a placement consultant and shall immediately begin searching for an appropriate placement for student. If necessary, it will consider out-of-state and unapproved placements. One final thought. Parents often pay thousands of dollars to therapeutic consultants for program recommendations. In this case, it was disappointing to see the consultant testify without fully aligning the program with the student's educational needs. If you're going to ask the district to fund a residential placement, everyone on your team, especially your consultant, needs to understand this is an educational decision under special education law, not just a clinical one. Alignment matters, and the difference can be the key between approval and denial. Lastly, if you're seeking residential placement funded by the district, you have to make mental health an educational issue. It's not enough for your child to need therapy. They need to need education in a therapeutic setting. So if you're heading into an IEP or a hearing, remember, language, evidence, and teamwork are everything. Make it clear your child's mental health challenges are stopping them from learning, and only residential special education can help. Thanks for watching. Stay strong and keep advocating. Please reach out to Ask the Advocate if you need help, and we can guide you in the right direction.